Happy Friday, everybody. Welcome back, and I hope we're fired up for one last day during the week. Yesterday, we talked briefly about the cerebellum and its influence over cognition and intelligence. One of the things I also wanted to talk about today is the cerebellum's role that it plays in emotional regulation. We talk all the time about how the adjustment can help the body better be able to manage stress and provides higher level cortical stimulation that allows us to get out of our reptilian brain or better control that emotional side of our brain. One of the amazing things that I read about was how it's been shown in clinical research that individuals with a decreased level of mechanical stimulation and or mechanoreceptive input from the body into the cerebellum or dysfunction of their cerebellum show behavioral issues, or most commonly show characteristics of behavioral disorders, whether it be, inappropriate behavior, inappropriate, understanding of social situations, as well as an inability to be able to show affect or emotion towards those around them. Does this remind you of anybody that you know? Maybe somebody that you work with? No, I'm kidding. But think about the impact on someone's life if they don't have the ability to connect with other individuals from an emotional level. Whether it be nonverbal or verbal communication, that's vitally important for being able to move forward and function throughout your life. Connecting with other individuals is what drives us forward. We've seen that over the last year where a decrease of communication and connection with individuals has led to some pretty catastrophic situations where individuals' mental health and overall health have started to decrease, and people have ended up in some really rough situations. So the power of the chiropractic adjustment is it provides that increased mechanical stimulation to the higher cortical centers in the cerebellum, which not only drive behavioral centers and emotional regulation, but influence their ability towards the positive. One of the big things we talk about all the time is how the frontal lobe or the prefrontal cortex is highly stimulated every single time someone is adjusted, and that drives our personality. Driving our personality is what allows us to align ourselves and push towards our goals, allows us to push towards things that we want to be able to achieve in life. And our ability to be able to stay out of that emotional part of our brain only furthers that ability. So I want you to think about people you may know in your life, or even some patients that you've come into. Think about the stories in which you've seen a patient change who they were from the beginning of care to the end. I'll use briefly a story of a patient that we've seen at High Street. When he first came in, he didn't want to give me the time of day. He was rather rude to me during the new patient exam because he was in so much pain and discomfort. I brushed it off because I knew that what we were doing here was going to change his life. And to make the story very short, he's one of the sweetest people that comes into our office. Now, unfortunately, he recently moved and is no longer a patient, but he became one of the sweetest guys, extremely nice, and one of those people that was actually very pleasant to talk to when we started to increase how well his body was communicating and functioning. And I know every one of you has seen that happen in your offices as well. So there is power in what we do. Power outside of pain, power outside of moving, power outside of increasing posture. We have the ability to change lives. Do that today. Have a rockin' weekend.